You've had a C-section. Now what? In this video, I'm going to teach you when and what to do with your scar to optimize your scar mobility and function. First thing to do after you get home from your C-section is make sure that you use ice or a gel pack to help decrease some of that inflammation and control your pain. You also want to make sure that you're minimizing any additional pressure. So if you cough, you sneeze, I want you to use a pillow to give you a little bit of support on the abdomen. That's going to help decrease some of that pain and pressure, which can make things worse. Next, let's talk about when you should start mobilizing your scar and why that's important. When your provider makes that incision, they're going through multiple layers of soft tissue, muscle, fascia in order to get to the uterus. We want to make sure that that gets nice and mobile so that you're not having back pain, pain with intercourse, or even leaks later on. Especially if you might want to try for that VBAC. It's really important to get things moving and mobile. You can start to mobilize the scar when things have healed. So when there's not an open wound, there's no glue or steri strips, and it's completely closed. If you're having some dark reddening, severe pain, you see the wound open up, or you have a fever over 100.4, those are all signs that you might have an infection. Make sure you reach out to your provider. Start by lying on your back. Mobilize the tissue around the scar, not directly on the scar. You can go all different directions, up, down, circles, both directions. Once the scar is closed, then you can start to mobilize gently on the scar itself. Make sure that your hands and your body are clean and there's no signs of infection. Later on, around that 10 to 12 week mark, you can get a little bit more aggressive. Lift the scar up and away, moving the body different directions and the scar different directions. If you have questions about C-section recovery, reach out to thrivepelvichealth.com. You can schedule an appointment or your local pelvic health provider.